So today's topic is on everything eye care. We actually have a well-renowned she's actually a special guest for today. She's a medical doctor specializing in ophthalmology. Her name is Dr. Srikewal from Durban and in South Africa. So welcome once again. And before we actually start, I have got a disclaimer that I would like to mention on behalf of Mindful Trinity. The opinions, views, and beliefs expressed are those of our guest speakers and do not necessarily reflect the viewpoints of Mindful Trinity or the policies of the company thereof. The content of the show does not constitute any legal or medical advice and is provided for the general insight and guidance. If you require specific legal, medical, or any professional advice, you should contact a specialist or a qualified practitioner. So again, welcome to Jyothi, Dr. Jyothi Srikewal. We are so grateful that you accepted our invite and here to share all of your insights and knowledge with all of us.
Hi, Vaishnavi, and hi to everyone who's joined us today, and thank you for having me.
Thank you, and we actually, as I said, we're very grateful to have you here. So just to start off our discussion, what does it mean to take care of the eyes? I mean, we all know the eyes are actually the windows to the soul, but not a lot of us know how to take care of those eyes.
Great question to start off. God gave us two eyes. You know, our eyes perceive up to 80% of whatever is expressed in this world. Our eyes allow us to see beautiful things, to see our families. Our eyes allow us to learn. Our eyes allow us, and it alarms us if there's danger. And we should ensure that our eyes are functioning optimally so that we can see the best we can.
Yeah, that's actually very good points because, I mean, like you said, we have to have a good eyesight in order to experience all of those wonderful things that the eyes actually can provide for us. When should one have an eye examination?
Before we go on to that question, just to expand on why we should take care of our eyesight. So let's look at it at a different angle. What happens if we don't take care of our eyes? What happens?
Yeah, exactly.
And so many things. The diabetic patient goes blind. The person who has uncontrolled pressures loses peripheral vision. The child who is extremely short-sighted and doesn't get corrective spectacles cannot see the board, cannot learn. So just to expand on that first point, there's many reasons why we should take care of our eyes, absolutely. To your second question, when should one have their eyes checked? So it starts at birth. When your child is born, or when a baby is born, the doctor checks the eye reflexes. Is there a red reflex? Are the eye movements aligned? And it's recommended that children at preschool age should have their vision screened to ensure there isn't a refractive error and corrected. If parents pick up any abnormality in their children's vision, whether it's misalignment or they feel that if their gut feeling tells them that their baby cannot see, they should have that baby's eyes checked. But as a general rule, I feel that any adult at the age of 40 who doesn't have any risk factors should have their eyes examined. So obviously, if you have other risk factors like diabetes or history of family blindness, you should have your eyes examined earlier. But I think every person who turns 40 should have their eyes assessed by an ophthalmologist to have a baseline screening done at least. And further to that assessment, perhaps every 3 to 5 years.
Oh, wow. So basically, you were saying at as soon as the child is born, I mean, from any age group, it doesn't matter. But if it's a born baby, how would you know that the child is having some problem with the eyesight?
So if the doctors usually shine a torch into the child's eyes, and if there isn't a red reflex, or if you see a white reflex, then that's pathological, and then we know automatically that further assessment is needed. Also, if a baby is born prematurely, if they're born before gestational age of 34 weeks, if they're born less than 1.5 kgs, if they've ever had to have supplemental oxygen, those babies by default need a thorough eye assessment, because they could develop retinal problems that cause blindness at that age, which is irreversible in most cases.
Wow, it's actually quite interesting when you actually put it that way. So what happens at at a screening at a normal ophthalmologist room?
Okay, so patient comes to see us, and we do their visual acuity testing, and that gives us the information, how much can that person see. If they can't see 20/20 or 6/6, which is optimal vision, do they have a refractive error? So we define their refractive error. Are they myopic, which is short-sighted? Are they hyperopic, which is being far-sighted? Or do they have something called astigmatism? And then we aim to treat that refractive error. We do obviously, combined with taking a history from the patient, we put them through many tests and examinations in our rooms, where we use our equipment to visualize the deeper structures of the eye. So we assess everything from the eyelashes to the eyelid, the conjunctiva, the cornea, the anterior chamber of the eye, intraocular lens, the retina, the blood vessels on the retina, the optic nerve, intraocular pressure, visual fields. So there's a lot.
Wow,
and
yeah.
it's actually non-invasive testing. Patients shouldn't be discouraged or fearful. It's a really nice, pleasant experience.
Okay, awesome. When you actually mentioned astigmatism, I actually have that, and although I do use my glasses, I don't use it all the time. Is there a cure for astigmatism?
Astigmatism is a refractive error, as you mentioned. So the cure for it would be using spectacles to correct the astigmatism, contact lenses. It means that the cornea is irregular in shape. So light enters and it reflects in different angles onto the retina. And therapy can include laser refractive surgery, which may make one independent of glasses or spectacles. Older patients who have astigmatism can have that corrected during their cataract surgery. So there's options for you, Vaishnavi.
Wow, awesome. I actually I try to use my glasses, but I don't like to use it all the time. But yeah, I know I'm bad, but I'm trying.
And Vaishnavi, in astigmatism, the cornea is steeper and irregular. And I find a lot of children who come with itchy eyes, chronic allergies,
Yes.
and they rub their eye a lot, and that actually induces astigmatism. So parents shouldn't ignore when their kids rub their eyes frequently and over a long time, because the chronic rubbing can affect the cornea and in turn affect their vision.
Wow. When you're actually talking about all of this, I'm actually thinking back when I was a child. I used to rub my eyes a lot, but I didn't know that was the cause of it. Well, I actually tried, not actually the cause of it. I think I increased it getting worse, you would say.
Perhaps, yes.
Okay. So what are the symptoms of digital eye strain? Okay, for me personally, I'm on my computer from the morning till the evening when I'm not teaching yoga, of course. But I know it's actually bad for my eyes. I do take my normal breaks, maybe 5-minute break now and again. But at the end of the day, when I'm going to bed, my eyes is very tired. So what
Correct.
would you say are the symptoms?
So digital eye strain, computer vision syndrome, it's the same thing. So the pandemic has resulted in people having increased screen time. Every work is off site and work has moved to online. E-learning platforms has flourished. We spend hours in front of the screen on our phones. I mean, Vaishnavi, if you had to look at your screen time on your Apple phone, that on your iPhone, that will give you an indication of how much of screen time one is actually doing.
Yeah.
And maybe a good idea for all the viewers to do that little exercise and just assess what is this screen time. And for many of us, the average is around 6 to 7 to 8 hours a day. And that's excluding our laptop time. It excludes our TV time. So we are spending a lot of time looking at screens. And the effect of that is, as you said, tired eyes, headaches, neck ache, shoulder ache, burning eyes, eye fatigue. You know, you just have to sit overnight watching so many series, and the next morning you feel like, oh my God, it's like a real digital hangover. It's like you are tired and your eyes are tired. So we can't avoid screen time. However, we should there's few basic rules to limit the bad effects of increased screen time. And for example, positioning of your laptop or your laptop or your desktop screen should be at least an arm's length away from you. The screen should be placed, it shouldn't be too low or too high to cause strain on your eyes to focus on the screen. So ideally, the screen should be placed, your eyes should be fixed on the upper third of the screen, basically. The 20-20-20 rule is very popular. So that means every 20 minutes, take a break for 20 seconds and look at something, 5 to 10 meters in the distance. If that's not possible, then, take a break now and then and just close your eyes for half a minute. Just give your eyes that time and to just recover from the screen. Limit the glare. So position your computer or your laptop so you're not getting the increased glare from outside, striking your screen and hitting your eye, because that also adds to the discomfort. I'm sure if people with kids would notice when they're in front of the computer or the television, they don't blink. So blink reflex is very important. Blinking seriously decreases when we in front of our devices. So try to blink every 5 to 7 seconds. Make it a habit. What else? To decrease the strain on your eye. You can increase the font size so that you're not straining. You can also decrease the brightness saturation of your device. And sometimes blue filter spectacles help to decrease the effect of the blue light on the melanin on your retina, and also it affects your sleep patterns. So little tricks to help your eye, keep your eyes lubricated. There's many off-the-counter eye drops that keep the eye moist. They moisturize the eye, keep the eye cool, things like that.
Okay, wow, very, very informative. Is digital eye strain permanent, or can it be cured? I think that's actually the number one question, if there's a cure.
I think it's a lifestyle modification, Vaishnavi. We got to do those little things. It doesn't cause damage that's irreversible, or you just have to prevent it.
Okay, you did give us tips on how to get rid of digital eye strain, so I would not ask you that again. So I'm going to go to our comments feed, and I see there's lots of comments from our audience. There's one from Sarika. She asked, does excessive use of iPads cause eye damage to kids? If so, what is recommended to prevent this damage?
So, Sarika, excessive iPad or screen time from the tablets for children causes short-sightedness over time. So there's an emergence of a short-sighted myopic population or generation because kids are focused on a task that's so close to their eye muscles are getting fixed to just focusing on that distance, and it actually causes blurred vision for distance. So they would not, over time, it'll cause them not being able to see a number plate without glasses, or see things in the distance. So the articles published about myopia in children recommend that limit screen time for kids, and please ensure that they have at least 2 hours of playtime outside without their tablets, and making them run around and look into the distance and things like that. It's not easy in our times nowadays, but I think we must make that effort to take kids off their screens for long periods of time.
Yeah. I've got one from Rosie. Rosie Moodley asks, what causes pressure in the eye?
Pressure in the eye is associated with glaucoma. And there are many causes of glaucoma or raised intraocular pressure. And they include, could be an inherited cause of glaucoma. If there's an episode of trauma, that can increase the pressure. If there's any sort of inflammation in the eye, that can cause trauma. Cataracts that can cause glaucoma. Cataracts can cause raised pressure. There's many causes, and that's where the ophthalmologist will help to classify the cause of the glaucoma and treat it.
Okay, I've got a question as well from another viewer. They actually sent me this earlier today. It's also about glaucoma, and he asked, can glaucoma be cured?
Glaucoma can be treated, and the aim of glaucoma treatment is to lower the pressure in the eye to prevent further erosion of the nerve. So glaucoma can be treated, correct. Then the treatment is aimed at preventing further damage. Unfortunately, the damage that has already occurred from the raised pressure is irreversible. So that's why it's in everyone's favor to get it screened early and treated early.
Okay, so you sent a lot of questions. I'm gonna just try and see where it's repeated, so I'll just downscale it, I would say. What does the, I can't pronounce it, I'll try and pronounce it. It's Spersatin eye drop. And what solution does it have for diabetic patient?
So that is an anti-glaucoma it's a pressure lowering drop that's used in the eye.
Okay.
It's a prostaglandin inhibitor, and it works to increase the outflow of aqueous fluid out of the eye, so it lowers the pressure, and it's of benefit in glaucoma patients.
Okay. You also asked, does it improve the eyesight? You did say there's no cure, but there is treatment for that. So I'm not sure.
So when you lower, if someone comes in and the pressure is 40 millimeters of mercury or 50, they're going to have blurred vision because the eye is high pressured, the cornea is swollen, it's blurred, and once you lower the pressure, the cornea swelling decreases, it gets clearer, and their vision does increase. Correct.
Okay, so there's another question. What does Lumigan Eye Drop does to the eyes? And yeah, there's another part to that question. I'll ask you that first.
So Lumigan and Spersatin are from this same class of drugs, so they have the
Okay.
same function. A
Okay.
person should not be on both because then it's redundant.
Okay. So you also ask if you treat glaucoma in an early stage, the early stages of your diagnosis, does it improve the eyesight?
It can improve your eyesight, Vaishnavi.
Okay.
Correct. It does. It definitely prevents it from getting worse.
Mhm.
But obviously, concurrently, the patient needs to be healthy and not be diabetic, and not be a poorly controlled diabetic. Not have cataracts. Treat their refractive error. So it's not only treating the pressure that will improve their vision,
Okay.
but it has to be emphasized that one's pressure must be controlled to prevent loss of sight.
Okay.
5, 10, 15 years time, when that person suddenly has no vision and no peripheral field, and that's very tragic.
Okay. This is from another person. He's saying that he's also using this Lumigan Eye Drop, and he notices when he puts more than one drop after a few days, the eyes pain and the eyesight becomes weaker. Only for a few days it happens, and then it becomes normal.
So perhaps the patient has a drug allergy or a preservative reaction. He should speak to his doctor and inform him about that. And obviously the agent can be changed.
Okay, okay, awesome. Okay, there's one here from Ashvir. He asks, are there any eye exercises you would recommend for those that spend a lot of time in front of the screen?
Hi, Ashvir. So yes, things like digital, like pencil push-ups. Take your pen, look at it, focus it, going in and out, looking in all directions, occlude one eye, look in the 4 quadrants. So those are simple things you could do at home or at work.
Okay, awesome. So let's see if we've got any more questions here. But whilst we actually do that, I actually forgot there's one more question that I have for you. How does one get rid of allergies in the eye?
Allergies, so common. It's so prevalent. So with all our pollution and we have every second, third patient coming in with allergies, and allergies present they present with itchy eyes, tearing. Many patients have concurrent sinusitis, rhinitis, eczema, asthma, and so those patients come in very unhappy. And allergies causes inflammation in the eye. So how do we treat it? We treat it, often we don't know the cause of it, and we treat symptomatically, and we decrease inflammation in the eye. So we treat with eye drops that decrease inflammation, and antihistamine eye drops. I always tell my patients to do cold compressions. So take ice, wrap it up in a towel, and place it over your lids. It decreases the congestion, it decreases the swelling, and it brings some sort of comfort. So allergies shouldn't be ignored. When we have a skin allergy, we have hives on our skin, so we know we have an allergy. And in our eye, on the inside of the lid, you get tiny bumps. So every time the patient blinks, it scratches the cornea, and that's what causes a lot of the discomfort. So listen to your body. Your body is trying to tell you something. Figure out, is it something I'm eating that's causing the allergies? Is it something in my surrounding, the environment? I don't know. Yeah.
Okay, sounds absolutely interesting. I'm sure it is actually very, very educational for all of our viewers listening. I'm just checking if...
Sorry, Vaishnav.
Yeah.
Talking about irritation in the eye, with the onset of COVID and people wearing masks, I'm finding a lot of patients coming to me with styes in the eye and very oily lids. And I think it's because of the mask preventing air from circulating around the eye, and it's causing drying of the cornea, drying of the eyelid glands. So eyelid hygiene is very important, and how people can do this at home is take any no tears baby shampoo, make a little emulsion, wash their lids, rinse it. And you can also do compressions with a warm cloth over the lids to help with that, to prevent that sty that's coming up.
Okay, that's very interesting, because I did meet someone recently that she also developed an eye infection, and well, now you actually explain about that. So yeah, at least we got some sort of to go forward. We actually know how to actually
Correct.
take care of the eyes. So I don't think there's any further questions from our audience. I'm just going through them, but yeah, if you guys have any further questions for Dr. Jyothi, you know where to actually find her. We're going to actually ask her further questions on where to actually find her in the outside world, and if she's on social media, whether she has a page or anything of that sort, she'll actually give that to us. But just to recap our conversation, I tried to take down notes like I always do, but I wasn't very good today. So I'm just gonna say what I actually picked up from our discussion today. You mentioned an eye exam should be done as soon as we think there is a problem, either with us or if we have little kids as young as a newborn baby. Once the doctor will check the eye, you will notice that something is definitely wrong. And also not a lot of disturbing of the eyes by rubbing it too much, that actually cause more disturbances and can increase any sort of problem that you may have. And yeah, every 20 minutes, the 2020 rule, I'll always remember this. Every 20 minutes, take a 20-second break, maybe look away from your computer, or even take a walk. Take a walk to your fridge or to your tap and get some water and drink, and try to get yourself busy away from the computer screen. Oh, and it's very interesting to wash the eyes with or the eyelids with no tears baby shampoo. I think all of us are going to be stocking up on that.
Degrease the lids, and Vaishnavi, we must become more aware of our eyes. Start the dialogue with your healthcare provider. Ask your optometrist, what is my vision? Do I have a refractive error? What is it? What is the pressure in my eye? What does my optic nerve look like? This is information that you need to know for yourself, so that when you follow up, you can always get more information.
Wow. For me it's been very educational, because you know what, I as I said, I'm very, very bad with using my spectacles all the time. I should be using it all the time, but I just don't like using it. And I think a lot of people are like me. What advice do you have for those type of people?
Make sure you change your prescription on time.
Okay.
As we age, we need to change our glasses, sometimes yearly, sometimes if you're unhappy with, maybe get it checked out. Why am I so uncomfortable using these specs? Are my eyes dry? Is that what's making it difficult for me to focus with my glasses or my contacts on? So don't neglect it, and address it.
Okay, thank you. So do you have any parting thoughts for our viewers?
Thank you all for listening in and joining, and I'm very excited about this moment. The eyes can tell you more than your mouth would say sometimes. So, you won't know you have a problem, but once we look into the eyes and examine it, we can pick up so many problems, from undiagnosed diabetes, glaucoma, rheumatoid arthritis, SLE, sarcoidosis. The list is endless. And look after your eyes, be kind to yourself, and we'll leave it at that.
Okay, I've got one more question. I think this lady just joined right now. Her name is Bhakti Rasa. She asks, can high blood pressure cause blurry vision at times?
High blood pressure, uncontrolled high blood pressure and very high systolics and diastolics can affect the blood vessels on the retina, and that can cause changes in vision.
Okay.
Yeah.
So this, you know what? I thought we actually coming to an end, but I see there's more questions here. If you don't mind answering
No
them.
problem.
Okay. So this is from
Rapid
Sarika.
fire.
Yeah. There's another one from Sarika. She asks, are the Blu-ray glasses from Discam advisable to be purchased for kids, or is it more advisable to get a prescription from an optometrist?
I would suggest a baseline assessment with the optometrist, and they can recommend, correct? Because you could use the blue filter, but if the child is short-sighted or has astigmatism, he or she will still have blurred vision.
Okay. Okay, there's another one from Rastastali. She asks, just this year, I learned that blue lights not only damages our eyes, but even our skin. And we should use products to protect our eyes and our skin. If someone has eczema on the eyes and uses strong meds for for eczema, then does that also affect the eyes in terms of vision?
It shouldn't, because you're applying the product to your eyelid. No.
Okay, awesome. Okay, I don't think there's anything further. Well, if I'm missing out on them, sorry about that. You can get in touch with Dr. Jyothi. Dr. Jyothi, can you also let our audience know where they can find you? But I see a lot of them also know you here, so yeah. For those of them that don't know you.
I'm on Facebook, and my name, I'm at Parklands Hospital in Durban. I'm always willing to help, Vaishnavi.
Okay.
All right.
Yeah, thank you so much. We are so grateful that you, took your time out of your busy Saturday, because I know Saturday is normally your time. I mean, all of us have a specific day, and weekends are normally our time. So thank you so much for sharing your time with all of us and educating us on this platform. And we hope
you're most welcome.
Yeah, we hope that we do see you again. Yeah, it'll be very, very beneficial to all of us if you do. Okay, bye-bye, everybody.
Bye.